open the door.
Full English me, I'm no school.
Hi!
Hello.
Hi, Doc Rob! Good morning, come in! I'm
Morning.
Kikay!
Good morning, everybody. Hello.
Good morning!
Hi, good morning.
Good morning.
Hello, hello.
Welcome, welcome.
Welcome to Good Morning, Kuya.
Welcome to our world.
Ikaw
Have a
sasabihin.
seat.
All right, brought my friend along.
Yeah,
Oh,
let's
have a
introduce
seat.
Dr. Rob Walcher III.
Yes.
Dr. Rob
Chiropractor.
Walcher III.
Good morning and
He's
good
a
morning.
chiropractor.
Thank you for having me.
Yeah, he's a chiropractor.
And I would just like to remind you, Kikay,
Yes.
he is with his wife.
Yes, the very
So you
beautiful.
better watch out.
Yes.
You better not cry.
Congratulations to your wife.
Yes, thank you. Very excited.
Yes.
Thank you
Ayan.
so much.
Before anything else, I would like to know what is chiropractic?
Yeah, that's a great question. You know, most people in the Philippines don't know what chiropractic is or what a chiropractor does, right? So a chiropractor is a doctor that evaluates one's spine, okay, their pelvis. We evaluate the nervous system, okay? So we basically take care of a person's health and well-being. So if you're showing symptoms such as back pain and headaches and fatigue, allergies, these are all signs that there's some type of a disturbance on your spine and nerve, and this is affecting your health. So chiropractors care for one's spine and nervous system, helping a person be as healthy as possible.
So what do you do?
I mean, what?
Yeah, what do we
Because I
do?
believe there are different techniques
Yeah, so-
involved in chiropractic, right?
What we do
And
is
what-
we locate what we call a subluxation. That's really a fancy term for bone out of alignment. So our spine can move out of alignment in many ways. Our pelvis can shift out backwards or forward. Our spine can deviate to one side. That's called a scoliosis. Our neck goes forward as we age. So these misalignments or subluxations over the years, they actually cause decay in your joint. We call that arthritis, osteoarthritis, degenerative joint disease. So this is why if you ever wondered, as we're aging, we're getting shorter, we're getting stiffer, it's because our spine is degenerating. Much like our teeth decay if we don't care for them, right? And we develop a toothache, right? It's because you have a cavity. It's the same thing that happens with our back. Our spine is degenerating the moment we're born from everyday stress. We just live with these ailments. We think it's old age. Oh, I'm 40, I'm 50, I'm supposed to have all these issues. It's really just a sign there's a problem. So we locate these problems with our hands, and we actually start the process of caring for it, restoring proper alignment and motion to your joints. So when we do that, we're instantly unlocking your joint, so freeing that joint finally, which has been stuck for decades. We're instantly reducing the stress that's developed on the nerve, communicating to your organs, your muscles, your immune system. So that's what makes chiropractic so powerful. We're instantly improving joint and nerve health, allowing your body to heal.
But Doc, how would you know how would I know if in case I feel something that
Yeah,
I need to
if you have a problem.
that I need to visit a chiropractor?
Great question. There's many ways. If you're just having back pain, if you're having headaches, maybe allergies, asthma, not sleeping well, numbness, tingling down your leg,
She's not sleeping well.
He's not sleeping.
right?
She has a backache.
Muscle tension, muscle spasm, tightness, these are all signs. These are called symptoms. These are the warning signals something is wrong. So when your spine's out of alignment, your nerves, they control everything. They tell your muscles to spasm. So that's what's causing the muscle spasm. That's what's leading to the headaches.
But how do you diagnose?
Well, you have many ways. You can take X-ray, you can do MRI, you can use your hands and feel these subluxations. And so what I do when a person comes in, we go through a thorough history, consultation, examination. We find out the severity of the problem, and I put people on plans to really get them really healthy.
Like, for example, Beth here.
Yeah.
She's complaining about backache.
Yeah,
Backache.
very,
And
very common.
she said that she has some sort of, what do you call that one? Back pains here, muscle pains, muscle spasms,
Yeah.
and what have you. So you better ask Doc Rob, how can he be sure that you have some problems with your
Back.
spine and that he needs to align whatever he needs to align? Huh? Okay, come on.
You're gonna go there?
You go.
This is expensive.
Oh, you go. You better.
You better stretch.
So can you like give us short the
check
diagnosis?
Yeah, you want me to
of
check?
her?
Okay, so
Oh.
yeah, so one of the common things that happens
You're
to
so
us
quick.
Be
huh?
kind
is,
to
you know,
me.
we all develop this tension
Mahal lang
here,
tayo,
right?
kaya-
We all
of
develop
course.
tension throughout the day, that middle back tension and neck tension, and we start to develop headaches. So the reason is because our posture's going forward. Okay, so when we start to crawl, when we're born, we have a natural curvature in our neck, and our head is back over our shoulders. But usually by the age of 15 to 20, our neck has straightened. That's called a hypolordosis.
And she's 40.
So of course, so as we age, it goes a little bit farther forward, and so the nerves will tell all these muscles to tighten and spasm and lead to headaches and neck pain. So what I do is I don't really focus on your symptom. I don't focus on the muscle spasm and the headaches. I start the process of realigning her spine, improving her alignment, taking the stress off the nerve, allowing the body to heal and function
So
properly.
can you now determine whether she has some problems with her spine? If she
know, I
needs some
can-
alignment or
Yeah,
what?
I can.
Because she's not actually moving forward. She's going to the right.
Yeah. So, one thing I can see is her neck is straight and slightly forward here. So, I haven't really checked her too much here just by standing in this position. But, these misalignments are occurring in all of us. Okay. They start at the moment we're born from stress. Okay. Such as, like how we sleep, what we do for work, and kids with texting and video games, backpacks, falling down. All of these stressors are accumulating every day.
Too much texting.
Yeah, crossing our legs, all these things that we do every day cause the structure to change. And that leads to these misalignments, yeah.
First, I need to undergo.
So she needs to.
You come into my office,
Straight
we would do a
down.
consultation, examination, and really find out what's going on.
All right, but a lot of people are actually hesitant to go to a chiropractor. One, sometimes they say that consulting a chiropractor is kind of prohibitive because of the price that the doctors are asking from the patients. What's the range of your consultation?
Well, a consultation is 2,000 pesos. And then what we do is we put people on programs. So we might recommend, 8 sessions, 16, 32, depending on the person's severity.
And per session is so much.
So if you're going to just pay one single session, it's 3,000. But most
So per
people,
session.
they don't do per session. They buy a package. So we're basically selling a result. You have these problems.
Yes,
it's going to take
that's
this
correct.
many sessions to get you better. One session doesn't fix your spine. Something that's been developing for decades doesn't get fixed.
So more or less, that's going to be 8 sessions in a package.
It depends on a person's age, if they're 10, if they're 20, if they're 30. Of course, it's going to depend on the severity. So our price is discounted when you buy a package. So the bigger package you buy, the bigger discounts. We want to make it affordable for everyone. We offer family plans. We take care. My office is filled with kids.
But what's the minimum package that you give
8
out?
sessions.
I'm sorry?
8 sessions.
8 sessions.
Oh.
So that's actually the sessions wherein you will be sure that there will be some improvements already.
Yeah, so.
Oh, that's good. That's good.
Do you have to be a licensed medical practitioner to be a chiropractor?
Yes, great question. So yes, a chiropractor, they usually go to some form of undergraduate school and get a biology degree or pre-med, some type of a science degree they usually have to get into chiropractic school. So there's 4 years of undergrad, and then you go to a chiropractic school, which is another 4 years. It's equivalent to medical school. We just are not taught pharmacology because we do not prescribe drugs. Okay, so we're the same as medical doctors. We are taught the entire systems, how the body functions, because we're responsible for diagnosing. When you come in, you're complaining of numbness, tingling, things like these types of ailments. I need to know what the problem is so I can diagnose it.
You really have to crack the bones of your patient because most of the time that's what they say and that's what they do in chiropractic.
Yeah, so that's a great question as well. So just so you understand, when your joints are when you hear that cracking, that is air that develops in the joint. Just like when you crack your knuckles or sometimes your knees will pop, that's air escaping the joint. So you understand, when our joints move, they actually get lubrication. That's what keeps our joints healthy. Our vertebrae are the same, but what happens, our vertebrae, they become stuck. They're stuck like this, or they're coming forward, or our pelvis is stuck. And over time, that's actually what causes the joints to degenerate. See, they need motion to get nutrients. So what we're doing by actually adjusting your spine, we're increasing that nutrients to the joint, so keeping your joints hydrated and healthy. So we do want to have that popping. Now, you don't want to do it yourself. It's not a good idea to be doing it yourself because you usually get into a habit of cracking your back and you'll do it 10 or 15 times a day. So that's not very good. So when we're doing it, we're specifically locating the joint that is stuck and being specific and getting the motion back so the joint will get healthy.
What does it mean if, in case your knees are always cracking every time you bend it?
Sometimes as we age, that's a form of a little bit of arthritis, osteoarthritis we develop in our knees. So that's called crepitus, that popping sound.
That's arthritis ko.
I don't have that.
You were asking something, yes.
I was wondering if this kind of treatment is also safe for children.
Very safe. So with kids, kids, we can help prevent scoliosis. They don't get sick as often. So if your baby's, not going to the bathroom or crying through the night or, having chronic ear infections, getting antibiotics, those are all signs that they have disturbance on the nerves. Okay.
But scoliosis can still be...
The younger you start, the better chance we have to improve it.
It can be treated by a chiropractor?
I have many patients.
So how many percent of the scoliosis can still be...
We can get, it depends on the severity of the person. We have people with 40 degrees, 30 degrees, 20, 15, all the way down to, 5, very mild. So we can get 5-degree improvement, sometimes 7-degree, 10-degree. We can make some exciting changes, especially when they're quite young. We can make bigger changes. So oftentimes scoliosis will develop with children. They're learning to walk, right? Every day they're falling down on their pelvis. The pelvis comes out of alignment, not pantay, diba? It's higher on one side. So the spine will grow crooked. That's one common cause of scoliosis. So bring your kids in. We can check their pelvis in alignment. We can help them get off medications and live a healthy.
Now, how often do you need to do that? I mean, after, let's say, a session of 8.
It depends on your goal. If you just want pain relief, okay, you might need to come this amount of time. You want more of a correction in your posture, you might need to come this amount of time. You want wellness and prevention, that's lifetime.
Wow. So you need to maintain that.
So I've been under chiropractic care for 23 years. I still get adjusted twice a month just for maintenance.
So for maintenance, that's going to be at least twice a month.
Well, it's up to you.
So right after your
once a month, you
package.
could do 4 times a month. Everybody, again, depends on finances and circumstances with time, so everybody's different. But you have to look at it like this. It's the ultimate investment into your health because your nervous system is the most important organ in your body. If it's not functioning properly, this is what leads to disease. And so chiropractic prevents that by keeping the nervous system healthy. So you got to look at it not like so much like you're spending all this money for this. You got to look at it like you're spending money for your health to prevent. And actually
Sometimes
save
also,
money.
sometimes also people are getting scared of being cracked by a chiropractor. Isn't it dangerous, or sometimes you might just do something that might just make me paralyzed?
So I think if you go to just anybody off the street and you ask them to try to crack your neck, that could be dangerous. But if you go to a chiropractor, they've had extensive schooling on how to adjust one's spine. Thousands, I don't know the number, but hundreds of thousands of adjustments take place every single day across the world. And across the world, chiropractic is extremely popular. And you just don't hear of things happening. You hear of things happening once every decade or so. So, I mean, when you put it in context like that, it's extremely safe. Yeah.
Well, Kika here is also trying to look for ways on how she can reduce her weight. Can it help?
Could it help or just my posture?
Well, chiropractors usually are extremely knowledgeable about nutrition. So usually most chiropractic offices will be able to help you with exercising, stretching, and nutrition. So does it help with weight loss? It helps indirectly because we do improve digestion and metabolism and things like that by, again, improving nerve function, which controls everything. So we help indirectly. A lot of that is your diet, though. So we can help you with those things as well.
Diet.
Yeah.
So where's your clinic here?
I have 2 clinics, sir. I have one in Makati and I have one in Quezon City.
Oh, in Quezon City, where is it?
Yeah, it's Tomas Morato.
What's the name of your clinic?
305 Post Building. The name of the clinic is Doc Rob Chiropractic.
Doc Rob.
Yeah, one in Makati, one in Quezon City.
Chiropractic.
Yeah, we came here 3 years ago. My wife and family, we decided we sold my business in San Diego. We came here to really spread the word of chiropractic because there aren't many chiropractors here.
So you're now based here in
Yeah,
the
we've
Philippines.
been here for 3 years.
How long was
3
it?
years.
3 years ago. Oh, that's nice. So
We're
you've
helping
learned.
tons of people. It's so
And
exciting.
you're married to a Filipina, right?
Patricia Javier.
The very beautiful.
And
This is Universe.
and you and you now know how to speak Tagalog.
Opo.
Pinahirapan mo pa kami.
Uno ka naman pala mag-Tagalog eh.
First in Tagalog. Konti lang.
We've been losing blood already. A lot of it.
I was having back pain.
You're doing very good. You're doing very good.
Your usual.
We've lost a lot of blood.
More or less.
Really, we take care of whole families. My office, I really preach wellness, so it's not really specific for athletes. But no, we have a lot of basketball players that come, PBA players, but a lot of celebrities, but a lot of kids, whole families and kids. Once a parent realizes, wow, this can help my child, so they're not getting every year, sipon, rhinitis, bronchitis. We can help keep kids off medications. It's parents like to.
Well, what can you advise those people who are cracking their bones frequently?
Yeah,
it's like whenever I am sitting like this, I always do this.
Yeah.
I do that, and I can hear my back cracking.
Well, what happens, the reason you're doing it, like people will do their neck and then they'll twist their back. The reason you're doing it, your body is communicating to you. It's telling you, your joints aren't moving properly, they're stuck. And so you feel this, slight, temporary relief by doing it. And then you start to get in the habit and you start doing it 10 times a day. And so think about it, you're doing something like that 10 times a day over 10, 20 years. You do create hypermobility in your joint, which leads to another form of arthritis.
Whoa.
So it is not good for you to do it. Because
So even the cracking of your fingers, it can also cause you arthritis.
If you're doing it 10 or 15 times a day, it leads to hypermobility, which means your joint moving too easy, so the body will recognize that and it'll calcify it. Same thing with the spine. So you don't want to do something like that 10 or 15 times a day. So if you start to see a chiropractor, we're going to locate the specific misalignments, and that urge will go away as we start to improve your alignment.
But okay, is that an alternative to surgery?
We help prevent a lot of surgeries. A lot of people come in with bulging discs or a herniated disc. Here in the Philippines, doctors call it a slip disc, but it's a bulging disc or a herniated disc. It's there forever. It does not go back in. It's a trauma, and the disc has bulged out. So oftentimes a doctor will want to do surgery because you have numbness, tingling, or sharp pain down your leg. We can help prevent those surgeries by alleviating the stress on the nerve. But there is no correction for a disc bulge. It is there. You have to manage it. And that's how chiropractic can be very good for that.
That's cool.
Yes, very safe, very galing.
Dr. Rob Walcher III, thank you so much for joining us, and it's a pleasure to have you here. Looking forward to seeing you in your clinic and have a taste of that kind of treatment you're giving out to your patients.
See, you're already sitting straighter.
Well, I'm quite scared of seeing chiropractors. All right, thank you so much.
Thank you guys.
There you have it, Dr. Rob Walcher III.